Hi, everybody. Welcome to the podcast series sponsored by the Conference of Consulting Actuaries on Innovative Healthcare Solutions. These podcasts are a series of interviews with actuaries and other people, professionals, really focused on delivering innovation in healthcare. And these sessions are really intended to provide insights about what's going on in an ever-changing world in healthcare. You'll notice behind us here that we've got a different venue than you typically see on these podcasts, and that's because we're coming from the Cosmopolitan Resort and Hotel in Las Vegas, where we're attending the CCA annual meeting. So we're in and amongst it right now. We're actually on kind of a lunch break, which is why you don't see too much, but you might see more activity. But there's about 600 people attending here. My name is Ed Pudlowski. I'm president of Morningstar Actuarial Consulting. I'm also chair of the healthcare community within the CCA, and I'm going to be your host for today. Now, I am really delighted to be joined today by Mike Johnston. He's an actuary with Quantum Health, and Mike was gracious enough to do two presentations here this week, and both of them happened yesterday. So we're going to talk a little bit about this. Mike, thanks for being here.
Yeah, thanks for having me, Ed. Appreciate it.
Right. So, Mike, before maybe we start, just give us a quick overview of what Quantum Health does, just so that they maybe kind of get a perspective of what the information you're going to be sharing with us.
Yeah, sure. Quantum Health is an independent third-party healthcare navigation firm. So what that means is Quantum is overlaid on top of a typical carrier solution, and we take away a lot of the things that a carrier really doesn't. So we are the only number on the back of the ID card. So that means instead of calling your carrier for any kind of issue you have with a claim or anything like that, you would call Quantum Health instead. Additionally, because it's that only number on the ID card, we take all the calls for providers, we do all the clinical services, and we leave the carrier to do the stuff they do really well, which is pay the claims and maintain the network, essentially. Part of Quantum Health's value proposition is that we train our people to ask probing questions, to use, something as innocuous as a benefits and eligibility call to maybe show a guidepost at the beginning of somebody's healthcare journey. And because our people are trained to do that, that gives us the opportunity to be there within, when the decisions are actually being made in healthcare, rather than, a typical carrier model, which may reach out to somebody after they've hit a, huge amount of claims in the system. All those decisions are already done. So that's kind of generally who Quantum is. We contract generally with self-funded employers, but that's who Quantum is.
And you shared a lot of data and a lot of information with us over the past 2 days. And that's because you have access to a lot of your clients' data, right? So you maybe talk about why that data is important to what you do.
Yeah, absolutely. I mean, because we're the call center for all member and provider calls, we really need nightly claims feeds for all our clients coming into our system, so that if somebody calls about a claim that has just happened, our people are prepared and ready to help through any kind of claims issue that an individual would have. Because of that, we have nightly claims feeds for all of our clients. And it is kind of an interesting spot from an actuarial perspective with all the data that we have, just that we can see data from lots of different carriers, lots of different types of employers. And it gives us just kind of a fun playground to really kind of search for things within the data.
Great, thank you. So you presented two sessions, one on, what's driving healthcare costs. And because we're in Vegas, it's like quick gambling on what's driving healthcare costs. And another one really kind of on the return on investment for disease management and care management program. So let's talk about the first one that you presented on healthcare drivers. You talked about a number of drivers that you saw, both in kind of national surveys sponsored by a lot of the large HR firms and other consulting entities. But you also back that up with data that you have directly from your organization. So maybe share a little bit what are some of those categories that you saw that were really kind of the big drivers of healthcare costs in today's environment?
Yeah, what we identified from some of those surveys that you mentioned, big one is behavioral mental health services, substance abuse. It's really been on a crazy trend over the last 6 years. And that's one that was called out kind of across the board in every survey that I saw. Additionally, more approvals for some of those specialty medications are coming out, those really, really high dollar medications. Certainly GLP-1s are kind of top of mind, in a lot of the surveys as well. And then lastly, the big area was just kind of rising facility costs for a lot of inpatient and outpatient areas. So it's sort of like catching up with all of the inflation that's gone on, kind of post-COVID. These facilities, which had been kind of locked in generally into multi-year contracts, you can just see within the data them pushing really, really hard to increase their fee schedules to kind of make up for some of that inflation that's happened post-COVID.
Interesting. Let's talk a little bit about the behavioral health category, because you shared some insights that I think our audience would really, I think would be eye-opening for them. And that was kind of the generational differences in behavioral health. Talk about that a little bit, because I found that extremely intriguing.
Yeah. So, what I wanted to do as part of this presentation was to just try to dig one layer deeper on all of this stuff and to get like a little bit better understanding, just mostly for me personally, of just like what is going on. So for the behavioral health, you always hear about this kind of in the news. It's sort of like a trendy topic to be out about what's going on with behavioral health. But I didn't really know what that meant. Really underneath everything. So one of the ways that I wanted to look at the data was generationally. How are all the different generations utilizing behavioral health care? And, much of what you hear in the news, which sort of sounds like somebody might be making it up, was like very, very evident in the data. Where we looked at it by generation. So we're talking about Gen Z and millennials, those individuals that are, say, like 13 years old to like mid-30s. Comparing them to, the baby boomer generation, those that are now getting closer to kind of Medicare age. And generally speaking, you would expect maybe a 4X for all medical care services based upon kind of Dale Yamamoto's reverted death.
So just kind of the fact that I'm older, I'm going to incur more services just naturally.
Yeah, absolutely. That's what you typically expect. But when you look at behavioral health services for those individuals with that as a primary diagnosis, it's kind of flipped in the opposite direction. You have Gen Z and you have millennials, which generally would be incurring 1/4 of the claims. They're actually incurring 3 times the number of claims as those baby boomers with that primary diagnosis of behavioral health. So it's like super eye-opening to me, just how much more and how much different it is within the system. Now, obviously, there may be some issues with how I pulled the data, maybe baby boomers have other diagnoses as their primary, and then these mental health things are still coming through, secondary or tertiary diagnosis. But still, because of how much it is flipped around, I just think it's super evident that generationally, people in the United States really deal with mental health care very, very, very differently.
And very differently by generations, right? So we talked about a little bit, obviously you don't have information in your data as to why people of a younger generation are utilizing services more, but perhaps attributable to more focus on behavioral health in our society today that may have existed years ago. Maybe it's a push by a lot of your clients to focus on behavioral health, and this is just a population touch on. We don't really know the answer to that, but I thought it was very intriguing. It wasn't something that was intuitive to me until I saw your data. So the other thing I want to touch on, I think everybody knows GLP-1s are kind of driving some costs, but I want to talk about inpatient services and emergency room, because you really talked about, in effect, seeing an increase in the unit cost that was driven by higher severity codes being in claims than perhaps you saw a year or 2 years ago. Can you talk a little bit about that?
Yeah, absolutely. This was one of the main trend drivers that we saw in the survey. So I wanted to figure out a way that I could pull from our data relatively simply just to see, can I find it in the data, this higher severity coding over time? So the way I ended up doing that was for Quantum Health's entire book of business, I pulled the 10 hospitals that have the most claims. And just in order to get the biggest sample that I could over the past 4 or 5 years. And then for those biggest hospitals, I looked at the CPT codes that had the highest amount of claims within those hospitals. And what I noticed when I was looking at that is within the top 10, every time there are these 5 codes for ER, which are 5 different severity levels that could be coded for someone coming to the emergency room. At the lower end there, I think it's the 99281 code. The facilities generally charge something like $500 per facility claim. Down at the other end, the 99285, they could charge $5,500 or more, so 10 times the amount essentially. And I looked up, how those codes look and how they're described. If I was, say, a healthcare professional, how do I know which one of these codes to pick? And what I really found was the descriptions are somewhat vague, and it really relies on the judgment of the individual that would be coding it, right? So because of that, you can kind of see the incentive from $500 to $5,500 for a hospital that's being squeezed on their margins with all the inflation to potentially, at the margin, upcode, go from 99282 to 99283. So when I looked at the data for these 10 hospitals over a 5-year period, it was about a 2 to 3% increase of those 99284 and 99285, the higher severity compared to the lower severity of the overall number of ER claims. So when you do the math and kind of work that out, it works out to something like 3 or 4% added to trend, not total trend, 3 or 4% additional on these claims just over the period. And in my opinion, there's no reason to expect the population's any different. Right? There's any different types of people coming to the ER, right? So I just thought it was fascinating that it was that clear within our data that there's this longer term trend to code on this higher severity.
Yeah. And again, some of the speculation that kind of came out of conversations with the audience was, we're obviously in a post-COVID environment where utilization of services in the hospital particularly were depressed because people just didn't want to go to a hospital. So like you mentioned, the inflationary impact, you've had a big COVID had a big impact on the healthcare workforce, and so they've had to pay more to kind of retain the number of people to continue to work there. So like I said, there's a lot of pressure on those, and maybe that's kind of resulted in them trying to upcode a little bit, I guess, to make up for that. But very, very interesting insight.
Yeah, and I think the only other thing I'll mention on there is when I looked at it by hospital, it was very clear that while we found that difference over our top 10 hospitals, not every hospital was the same. There were some of them in there where it was flat across a 4-year period, nothing changed. And there were others where it was this massive uptick. Yeah. There was another interesting comment from somebody in the crowd when we had our session was, did you look if these hospitals had changed to a private equity arrangement? Yeah. And I just thought that was something fun to potentially dive back into the data. I haven't got a chance to do it quite yet, but it was an interesting idea that, maybe extra evidence that this is truly something.
And there have been some studies out there that suggest that once an entity is acquired by a private equity, you can see some of this type of behavior. Exactly what's driving it, what's causing it, certainly don't want to disparage any entity after that they're doing anything.
Absolutely.
It's kind of an interesting connection that does require, I think, some further assessment and evaluation. All right, so let's move away from your first presentation now. Let's talk about your second one, which again was on looking at the ROI of point solution. So you made a statement in there that not all ROIs are equal. Yeah. Can you explain that a little bit?
Yeah, kind of. As Quantum Health kind of touches on, most claims that come through the system, it's a huge part of our value proposition for us to be able to, back that up with real ROI, right? And being able to report on that into the year. To the sense that, many organizations have lots of different point solutions that are all trying to claim ROI. We get into the middle at times of trying to think about, okay, there was definitely savings here. How do we kind of assign it among different things? So that's why it's kind of important to our organization on ROI of why why we need to be able to do this. But from what we've seen, depending on who the organization is, they define how the savings work in very, very different ways. There's sort of a continuum between softer savings where it's really related to something that never happened, and it's a little bit hard to tie back to any sort of activity that the solution may be doing, all the way to a very hard savings where it's like trying to, in the most actuarially appropriate way, project future, project future, or project claims into the future, in order to, really see what the overall financial impact would be. So yeah, there's definitely a continuum from soft to hard, and that's kind of why not everything.
Yeah. And I know at Quantum Health you offer two types of performance guarantees to your clients, activity-based and claim-based. Do you want to talk a little bit about both of those and the differences between those?
Yeah, so I think the activities-based is really more, generally speaking, on the softer side of the savings, but it's a good way to kind of, tell the story of what Quantum is doing on a daily basis to help drive our savings. So it looks into all the activities that our people, our care coordinators, our clinicians do on a day-to-day basis, and the underlying value of each of those activities on an average basis. So it counts up what we're doing, takes the value for each activity, multiplies it all out to get to an overall savings. You can see there kind of in the way that type of approach works, some potential downsides of it's not necessarily tied directly to how the finances of the organization are going, right? But it is a good storytelling thing. Generally, and then as far as the claims base goes, I mean that is a more classic, if you're creating a budget for an organization, you look back to prior claims, you trend them forward, you make adjustments for other known changes, and then you compare that to in the same way once you go live, sort of a pre-post analysis. And that's directly tied to the bottom line of the organization at the end of the day. So we do have those two different types of guarantees. Generally speaking, the claims-based comes into play more so for all market clients that have more credibility.
And you could more easily kind of prove the actual results. Right?
Absolutely. But the activities-based is still valuable kind of across the board because it allows us to kind of, you can see from the claims-based approach, we're claiming savings, but we're not saying how we got there at all.
Right.
We're saying here's the savings, but what happened to make that work? So it's really the combo of those two things I think that can help to tell the full story of what's really happening.
Yeah, the activity-based really helps support the kind of claim-based, and then like you said, for the smaller organizations where credibility, understanding what that value is, maybe a little bit more difficult. Those activity-based performance guarantees provide a little kind of stronger support for the value that Quantum Health brings.
Yep. Exactly.
Great. So, really important question here as we start to wrap this up. We're here in Las Vegas. How much did you win or lose down at the casino?
My boss is here as well, and he wanted to go to the blackjack table. So we went last night. I lost $60, and that will be the end of it.
That's great. That's great. Mike, I really appreciate this. I'd like to encourage our viewers to also participate in our healthcare community within the Conference of Consulting Actuaries to continue any discussions about the insights that we're sharing here on in that platform, in our community platform. And if you're watching this and you're not a member and you're an actuary, I'd really encourage you to join the CCA. There's a lot of benefits you get from our communities, as well as many other benefits from the CCA. Mike, again, thanks for joining us here today. This was great, fantastic. One, not only do I appreciate being here for the interview, but I appreciate you coming in and presenting valuable information to the members here at the CCA. I know they walked away with a lot of great insights. I know I walked away with some great insight from it. So, again, really appreciate you being here today.
Yeah, thanks for having me. And just, would like to say to anybody out there who has not been to the annual meeting, this is my first time. people do not fight it. There's been a lot of really good information. We've had some great AI sessions that I've gone to that have been pretty eye-opening for me. So I've really enjoyed my time. So if you're on the fence about coming, just go for it. It's fun.
Great, but I'm not paying you back the $60 with us for that conference.